Oh, you have to enter, right?
Okay, so my name is Nina DeVault. I'm the school nurse here at Glacier Creek Middle School.
What is your job?
So as a school nurse, I help with students who are ill, not feeling well at school, medications, and then I also do a lot of training for the staff in the school here, for them to be able to take students out of the building and administer medications and know when to give emergency type medications.
Why, as a nurse, you are qualified to talk about medical marijuana?
Why, as a nurse, am I qualified to talk about medical marijuana? Well, medical marijuana is referring to using the whole marijuana plant to treat a medical diagnosis. Nurses are the front line in administering treatments in hospitals, clinics, in homes. So I think with my experience in healthcare, it makes me a little qualified to talk about it.
What is your professional opinion on the use of medical marijuana and why?
Well, I think there are obvious cases in which it feels inhumane not to give a suffering person something that will make them feel better and to increase their quality of life when they're feeling already so uncomfortable and that they're suffering so poorly. So I think science has shown a lot of support in showing that medical marijuana is a good thing. There's two chemicals in marijuana that are most popular in the medical community, and those are THC and CBD. THC helps increase appetite and decrease nausea. It decreases pain and inflammation, and it also helps people who are who have poor muscle control, always really tense, shaking, or they just can't control their muscles. It allows them to have more control over their muscles and be more relaxed. THC is also the part of the marijuana plant that makes people feel high. It's the mind-altering chemical in the drug. Then CBD, that one is not as popular on the streets because it doesn't make people feel high, but it does decrease pain and inflammation. It's used, like CBD oil is used for childhood seizures. It helps in all sorts of other ways as well. So other than those two areas, marijuana extracts have also shown to kill some cancer cells. So there's all sorts of areas in healthcare that science is showing that marijuana can help not necessarily cure, but help along with the treatment plan to make people more comfortable. So I think there is definitely some positives that will come out in the future as far as possibly using medical marijuana to treat some chronic illnesses.
What problems do you think may occur if medical marijuana is legalized in Wisconsin?
What problems may occur if it's legalized? Well, before it gets legalized, they'll have to, of course, figure out ways to regulate and make sure that the drug is pure, that it's not contaminated with other synthetic kinds that would be dangerous to patients. A way to monitor and regulate it throughout the population. It might be, would it put the patients at risk for criminals to target them and then be robbed? Would they be put in danger if they have access to a drug that might be in higher demand but still illegal for somebody else to obtain? Other problems would be possible increase in impaired driving. So not only does Wisconsin struggle with drunk driving, we also may be putting more drugged drivers on the street with that. And then if they legalize it for people to smoke, just how secondhand smoking is really dangerous when people are smoking cigarettes. The smoke from marijuana is even more carcinogenic, meaning it has a higher chance of causing cancer. So that puts other people at risk. Children, other people who have sensitive immune systems to be at risk to breathe in more smoke. And then it also puts the patient at risk for lung problems as well. But when someone gets to the point where they need medical marijuana, it's generally the risks, or the benefits outweigh the risks as far as probably the lungs go. So I don't know. I think there's a lot of research and everything that still needs to be done, but I think there's a lot of promising things that will come out in the future.
Thank you for letting us interview you about medical marijuana.
You're very welcome.